everybody. Hello, everyone. We are so excited to have you here with us today. In case you are new around here, I am Hillary Buchholz, and I'm here with Patty Quinn.
Hello.
And we are the co-founders of We Heart Hounds, and we are also super excited because we have one of our very most favorite guests that we have with us today. So.
I know. Oh my gosh! If you haven't been with us before, you're in for a super real treat. We have Dr. Brent Crabtree with us. He is Ginger's doctor and vet extraordinaire, and he's gonna take some time out of his day. His very busy day, I must say, to answer all of our questions about our pups and our kitties and all kinds of pets that we might have at home. And we have received some questions ahead of time, and I can't wait to really dive in and learn all about these really great, smart questions. I think they're going to help everybody here that's going to be listening today.
Yeah, it's good to be here. Thanks for having me.
Yeah, thank you so much for being here.
So as Patty mentioned, we asked everybody to submit questions earlier, but if you are listening now or you're listening on the replay, you can definitely type your comments in and we'll try to get answers to those questions as well. But our first few questions are from Christy, and one of her questions is, have you ever heard of prescribing melatonin for hair loss? My current foster pup was shaved and the hair on his back didn't grow back. He's a double-coated breed, a Sheltie. My vet suggested melatonin along with vitamin E oil on his skin, which seems to be working.
Yeah, so it's a pretty uncommon treatment, but it has gained some popularity in recent years. So basically the thought process behind it is dog hair, just like our hair, has kind of seasonal growth, and so there's some dogs that will lose hair, particularly in their flank areas. It's more common in bulldogs and boxers and some other breeds. We actually had a mastiff in yesterday that we suspect has a seasonal flank alopecia or hair loss there. But the melatonin, if given at the right time, basically tricks the body's hair growth cycles. And so it keeps them from losing that hair. Now, it's not something that's going to take and make their hair grow really nice and full if they have a poor coat otherwise. But more for those seasonal hair loss that they have, it can help with that. Not a guarantee, but it's safe, pretty cost effective. And so there's a handful of dogs each year that we try it with and have had decent success with.
Okay, great. And what does the vitamin E do? Does that like help with the skin and the oils in your skin and all of that?
A lot of times we're kind of approaching that from kind of along the same lines as fish oil. So it just helps moisturize the coat and provide for the more of the nutrients for the coat to grow.
And is that something you rub on, or do you give them in a tablet form?
Usually you give it in tablet form. Some people will, of course, there's a lot of things you can try. Some of them have been proven to not help. Some of them we haven't proved one way or the other. But some people will put coconut oil, either given it by mouth or right on the skin. And I think it can help soothe the skin. Does it really help to treat anything? I don't know. Maybe.
Okay. It's probably like us putting baby oil right on our skin. It's kind of like might help it be soft for a little while, but maybe not something long term. Yeah. Placebos always are a good thing, right?
Yeah.
It makes it feel like you're doing something. Okay, that's great. And then Christy has another question. Let's see. I'm going to read it here. So this is, again, I think this is the same 6-year-old pup, just finished 8 weeks of crate rest / restricted activity, post heartworm treatment. He still occasionally coughs. And so her question is, she has a couple questions. Will the cough ever go away? What is the anticipated success rate of heartworm treatment using 2 shots of melarsomin? Thank you. Melarsomin. It's so much easier when you say it. And then, are there any long-term concerns that I should have for his health since he's had heartworms? She's concerned about heart failure or heart murmurs and things like that. So I know it's a lot. I can repeat them if you want, but first of all, will the cough ever go away?
Yeah. So, fortunately or unfortunately, I think that's something where time will tell. When dogs have heartworms, we know that it can cause some level of permanent trauma to the heart, and, potentially inadvertently through the airways. But you really don't know. And obviously, even if they have a cough when they're diagnosed, unless they're in, end stage congestive heart failure, we still recommend treating them because we know what heartworms will do to them. The treatment, we can at least hopefully slow it down, if not stop that damage. And then a lot of dogs will go back and have a completely normal quality of life with no long-term effects that you can really pick up on. So the cough may get better. It may not. My thing is, as long as it's not worsening and that individual dog has a good quality of life, I would take that as a win.
Okay. Yeah. Yeah. Okay. And then she said, what's the anticipated success rate of using the 2 shots of, and then I can't say it again, Melarsoline?
Melarsoline, good job.
Okay.
If it helps any, Diarrheban is the brand name, so that's not really easier. But yeah, the overall success rate in treating heartworms, the last time I looked, I think it was around 84%. Now that's 84% survival rate. Of course, everybody looks at it. So a success is considered the dog went from being heartworm positive to heartworm negative. Doesn't really look at their overall quality of life. But that's what we're looking at. They survive treatment. They convert to being negative. That's a success. 14, 16% of the patients that are diagnosed with heartworms either aren't treated and pass away from it or die during the course of treatment because of the complications of it. So now, I can't speak for every veterinarian. I know we generally follow the American Heartworm Society guidelines, and we use a 3-injection protocol. So that's where the statistics that I'm using are from. I don't know how much different that is for the 2-injection protocol. I know the 2-injection protocol is not uncommon, and I would imagine has a fairly similar success rate. But and then as far as long term,
possibly go back and ask for a 3rd shot, or and ask and see what her vet says, or is it a different medication when you go for?
I think the main thing is to make sure that he or she converts to being negative. If she does, then that's fine. The medication it's a toxin. At the end of the day, it's an arsenic-based compound, and so basically we know that it will kill the heartworms generally before it's going to cause severe trauma to the patient, but it's the lesser of the evils at that point.
Right.
And most dogs do very well with it. It's just something where we have to watch them. They can have some long-term effects, but I would say it all depends on how that dog was doing when it was diagnosed and how quickly we treated it and how they're doing now. The vast majority of the pets that we see with heartworms haven't ever been and probably won't ever be clinical for it. And so we treat them as we would any other pet. And expect a normal quality and quantity of life.
Okay, so she shouldn't necessarily be too worried about any heart problems in the future.
It's just something that she'll follow up with her veterinarian.
They'll just keep an eye on it.
To say, do we have any signs of heart disease? And go
Okay. All right. Yeah. Thank you for that. That was helpful.
We have a couple questions. So we have Megan Elizabeth wrote in, one of my dogs is a Great Pyrenees. How do I keep him cool in the summer? He doesn't like going swimming.
Okay. So every dog's a little bit different. A lot of the guardian breeds and herding breeds that have those really thick coats, I know we're always tempted as pet owners to be like, well, I know I get hot when I have extra hair. And so get the haircut. And that actually has the opposite effect on those dogs. So some of those double coated and thick breeded dogs, that coat acts as their insulation. So it keeps their skin and body cool in the summer and keeps their body warm in the winter. And so the last thing you want to do is cut their coat. Yes, there are occasions where, dogs are severely matted or something like that, where they have to shave, and then we just have to know they can't regulate their temperature. So we have to be more mindful of it. Your dog probably just needs to adjust to it. And so that all depends on your lifestyle. Great Pyrenees love to be outside, but if he's accustomed to being fully indoors, then he probably won't ever be able to really tolerate the high heat. So he goes out for 10, 15 minutes, plays, does his business, comes back in, and that's okay. If he is a fully outdoor dog, then he will adjust to it and probably won't need any supplemental care as far as regulating temperature. So depends on what that dog's individual lifestyle is. And obviously, if you ever need to or have to make a switch, that's when you have to be mindful of watching his how he's doing.
What do you think about adding like ice cubes to water bowls and things like that, like in the summertime?
Yeah, you can. So that some dogs are more inclined to drink more water if it's in different forms, if it's moving water, if it's ice cubes, all those things. And the way I look at it is very rarely is a dog ever going to drink too much.
Okay.
So if it encourages them to drink, great. Is it going to help them regulate the temperature? Probably not.
Okay. Okay. All right.
Right.
All right.
I also have another one here from Christy that's a little bit on the same line. So with it being the dog days of summer, what's the best way to administer first aid if a dog is showing signs of heat stroke? Some things that she's read say to not to cool them down too quickly, and others say that it's okay.
Yeah. So that was a little bit complicated because ultimately if your dog has or is on the verge of a heat stroke, the single best thing you can do is get them to an emergency clinic. Because yes, there's first aid that you can do, but at the same time, when that same dog gets to an emergency clinic, there's a lot of multitasking going on. So not only are we actively cooling that dog down, we're getting an IV catheter in, starting fluids, checking their internal organ values, doing all those things and treating them for shock. So if it ever comes down to, hey, we've got 10 minutes and we can try to cool them down here, we can get them to a clinic, take them to the clinic and save yourself some time and potentially save their life. But if it's something where you're waiting for, someone to pull the car around to get you picked up, if you have cold water or potentially like rubbing alcohol, you can squirt that on the bottom of their paw pads. Because that's where they sweat, where their body temperature is more regulated. So you can soak their feet in those things, and that will help to cool them down. You can soak them in cool water, not ice cold water, but straight out of the garden hose, if that's something you're close to, obviously, to help cool them down. And again, none of this replaces getting them to an emergency clinic to have them evaluated. And if you're not sure that they're having a heat stroke, I'd err on the side of caution and take them in because time is critical in those situations.
What are the signs of heat stroke in a dog? Like, is it excessive panting, or like what would I look for?
It can be excessive panting, becoming extremely lethargic, collapse, all those things. So, it's kind of like in people, there's a lot of people complain of being dizzy or lightheaded. Well, think of what that might look like in a dog's perspective. They're not going to tell you they're dizzy, but they're just going to lay down and just be a little bit disoriented maybe. So kind of wide open, but more often than not, if a dog got left in a car or if it's a bulldog that went on a walk on a hot day, you assume it's heat stroke until proven otherwise. Okay.
That's good to know. All right. Perfect. All right. Those are some really important things to talk about and consider. Certainly this heat of the summer is gone. So thank you for that. So we have another question from Beth. She asks, when should I schedule a dental cleaning for her pup?
Yeah, that's a great question. And I would have to default to your veterinarian because every dog, every cat is different. Had this discussion with somebody the other day. They said, well, we had a small, it was a Yorkie or a Chihuahua, and they said we did a dental every year. That's great. That's probably what was needed or recommended for that pet. Now they have a large breed pup, so they were ready to get their teeth cleaned at a year. Well, most large breed dogs are not going to need their teeth cleaned as often. They've got the same amount of teeth in a much bigger space, and so they don't have that tartar that builds up. Now, there's also certain genetic components that come down to it. Some dogs are just kind of bad teeth. Depending on what diet they eat or what treats they have, what things they chew on, they may need more or less dental care. But it's hard to just say, hey, every dog needs a dental cleaning at the age of 2. Small breed dogs, I would say if they're under 20 pounds, they're probably going to need a dental cleaning by the time they're 2 or right around that time, unless you're very proactive on brushing their teeth and giving dental treats and things like that. There's a lot of our larger breed dogs that may only have 1 or 2 dental cleanings in their whole life. And that's according to our recommendations. Now, you can be more proactive about it and say, well, I want to clean them every year because if it's good to keep them clean, we keep them clean, and that's okay. It just may not be the best thing you can do for them.
Okay. Are there certain dental treats and things that work well that you've found, or?
Yeah. So when you look at dental treats, anybody can put dental or oral health or anything like that on their label. And so, and they do the same thing for people too. And so those things don't necessarily mean it's a better treat or better value for anything else. But there is it's called Veterinary Oral Health Council, VOHC. And I think they have a website you can look at different treats that they've actually tested and shown what's the benefit, and if you give it according to the manufacturer's recommendations, here's the expected benefit of it. So some of those things are, greenies, the little green bones that they have. Milk Bones makes one called a brushing chew. And I think if you give one a day and your dog chews it right, so they're not always the best treat for labs because labs just might have been half a swallow.
Yeah.
Or beagles or
Yeah.
bassets.
So,
or
if your dog chews it appropriately, then giving one a day is comparable to brushing. I think it's 3 to 4 times a week. So those can make a big difference. But there's all kind of water additives and different things you can do. And again, kind of back to all the different oils that we use. Probably what hurt them, but is it going to help them? And is it something that's going to make a big difference? Maybe.
Okay. All right.
Yeah.
Well, thank you.
I do know, I've tried one of with Leon because he had he was a dachshund and had just such bad teeth from I think genetically and just had a really rough time with his teeth. We had tried some water additives for him, and we never got to the point where we could see benefit for him because it made Lulu, our Basset, sick to her stomach. So I think you can just be really sensitive to some of those things. Like some dogs can be really sensitive to those things. So that would be one of my recommendations is just watch real close of that one thing that you're changing and try to keep it to one thing. And
so absolutely.
All right. Perfect. And thank you, Christy. She put up the link to the vohc.org site. So for anybody else that's interested, thanks for doing that.
Thanks. And I have one more question from April. How can I prevent my dog from constantly chewing her paws? That's
another great question. And if I had that answer, then so it also depends on why your dog is chewing on her paws. There's a couple big causes, and obviously this is coming from a standpoint that I've never seen your dog, don't know anything about it, but the most common cause for a dog to chew its paws is some form of an allergic dermatitis. So when people have seasonal allergies, environmental allergies, we usually have more sinus issues. So you get the sinus headaches, you get the nasal drip and all those things.
Right.
When dogs have seasonal or environmental allergies, it shows up as itchy skin. And dogs, cats, people, we all have more nerve endings proportionally in our face and our feet. And so those areas seem to itch more. And because feet are easy for the dog to reach, they lick and chew at them. And then it depends on what that allergen is. Can we eliminate that allergen? Do we use medications like Apoquel or Cytopoint, something like that, to decrease that itch and inflammation? Is there a secondary bacterial or a fungal infection there that's contributing to that itch? That's something that can be mitigated through medications as well. But it there's a lot of things that go into that or could contribute to it. There's other reasons dogs can lick and chew with their paws. I mean, obviously, first, the easiest thing is do a visual inspection. Is there is there a burr or a thorn stuck in their foot? I'm sure we probably check for those things. Sometimes you can have dogs that develop more of like an OCD type tendency where they just want to lick their feet, and because it's easy, they do. Now, a lot of those dogs end up licking more kind of over their wrist areas rather than the chew in their toes, but you can't really rule it out or rule it in from just looking at it. That one's, in my experience, a little bit harder to treat because some dogs just like to lick their feet. And
can you substitute it with like a toy? I know when dogs are puppies and they're kind of nipping at you, you kind of substitute your arm or your foot or whatever for a dog toy so they know that that's the appropriate thing to chew on or bite, and maybe do the same for,
you can do that.
if it's just a soothing, if that's what they're doing, it is for a soothing kind of, maybe just substitute it with.
Right. Or sometimes even just a distraction of saying, hey, you're doing this because you're bored or whatever. Let's go on a walk. Let's go play. Let's do something.
That's a great idea.
And that can help. Again, playing devil's advocate, some dogs, they're fine. But then while you're at work and they're home.
Right.
They go to town. They're on their
Yeah. All right, great. Well, those are all really good questions, good answers. So then we have Christy. Hi, Christy. Thanks again for all your questions. She says, Max is a good example of why you don't want to skip the heartworm meds. Thank you for answering my questions. Never heard about spraying the feet with rubbing alcohol. We'll have to add that to her first aid kit and the one I keep in the car. You're such a good dog mom, Christy. You're awesome. I think that's great. That's awesome. Asking some really thoughtful questions too. And she said the pup, at least one of the pups we were talking about, her foster pup, will probably be a foster fail. So I hope so. I hope you get to keep the pup forever and ever.
Good for him.
Yeah, that pup will be landing in the honey hole. It will be very spoiled the rest of its life, I'm sure. So that's it for the kind of questions that were submitted. Dr. Crabtree, while we have you, is there anything else that you kind of are seeing as a trend, or anything else that you'd like to chat about while we've got you here for just another minute or two?
Yeah, absolutely. So one of the things we've seen a lot of lately, I know as a lot of the COVID restrictions have been getting lifted, a lot of folks are starting to travel more. So the dogs are being boarded or just getting their summer haircuts, whatever it may be. And somewhat due to that, we're seeing more cases of what we would consider kennel cough.
Okay.
Kennel cough is a big class of upper respiratory infections. So there's some viruses, there's some bacteria, some of the things we can vaccinate against, and some of them we can't. So most of our patients are still protected, but we get these calls that, hey, Fluffy was boarded for one reason or another. We picked her up, a few days or a week ago, and now she's got this really nasty cough. What do we need to do about it? And obviously, it all depends on your relationship with your veterinarian. Sometimes they're comfortable giving out information over the phone, and sometimes they're not. But if your vet knows your pet and your pet is eating, drinking, using the bathroom normally, still pretty interactive, you may not need to do anything about it. With a lot of the kennel cough cases, most of them are viral and are going to run their course within a week or so without any intervention from us, similar to us contracting a case of viral bronchitis. You feel crummy, you sound terrible, sometimes you look terrible, but give it a week and you're going to get better. You don't necessarily need any treatment. Now, if you have pre-existing respiratory conditions, if you're a really young patient or if you're an old patient that may be immune compromised, those are the ones I'd be more concerned about, maybe consider getting those into a veterinarian sooner rather than later. And obviously, if you ever get to where your pet is not wanting to eat or drink or do those normal behavioral things, I would definitely get them in to see your veterinarian, because they can develop secondary bacterial infections and pneumonia and things like that. So, but just because they're coughing doesn't mean they have to be seen.
Is there a certain amount of time that you if they're still eating and all that stuff, but it's been 10 days or something like that, is there a certain amount of time where you'd say, okay, it's probably time to bring them in, even though they're pretty much acting normally, but this cough has just hung on a lot longer than you would expect? I
would say somewhere around the 7 to 10 day mark of coughing. Every strain is a little bit different, but the one we've been seeing more recently, it seems to be about a week after they've been boarded. Or sometimes it's hard to tell for sure, because they're boarded for a week, and so you don't know exactly when they were exposed. They start coughing 3 days after they go home. Well, I don't know when they were exposed, but I would say if they've been coughing for a week, and if it's not getting any better, I'd go ahead and get them into a veterinarian. I know, and I think this is the case kind of across the country, I know a lot of veterinarians are busier than they ever thought they would be lately, and it's a good problem to have. But I know it's tough when you feel like your pet is sick and your veterinarian may say, hey, we can't get you in today or maybe even tomorrow. And I know that can cause some frustration and some worry. But again, I think if your pet in that situation is otherwise acting normal, I think you're okay to wait. So, maybe go ahead and schedule that appointment for a few days or even a week out.
Right.
You can always cancel it and say, hey, they are better. We're good.
Right.
So that way, God forbid they get worse, you're already on that veterinarian's appointment schedule. And
on their schedule. Yeah. So Christy has a question. Is there a difference between the kennel cough and kind of a heart failure cough? She's asking, is maybe one raspier than another? Is there a difference that we can see or hear?
Yeah, there can be. It's not always 100%. A lot of people describe the kennel cough as a goose honk. So if you you can probably look up videos on YouTube of that cough. Not every dog's going to sound like that, but the kennel cough, it's hard to say, generally is a dry, harsh, non-productive cough. So they're not coughing up a lot of stuff. Every once in a while they'll cough up a little bit of kind of white mucus just from clearing their throat. Right. Whereas in general, your heart failure cough is a deeper, it sounds kind of, the cough sounds kind of wet.
Okay.
But again, not always.
Okay. All right. Yeah. It's hard because, every pup's different, and the condition itself within that dog might be different, level of severity or all that kind of stuff. But I think it's a really smart idea to call your vet, talk to them about the situation. If you can't get in that day or whatever, definitely make an appointment that, for whenever you can get in. And then if it has to be canceled because your dog's getting better, then that's, great news, right? Yeah. You're doing everything you can as a pet parent to make sure that their pup, and Dr. Crabtree will know, I will make an appointment, even if it's, no, I'm not like very, I don't freak out about little things, but I probably come in more than I might need to in case there's something going on. I'd rather know for sure, but not every little bump and bruise, but I definitely make appointments when I'm not sure, what's going on. And if they come back and say, hey, everything's actually pretty okay, just let it run its course and you're fine. I'd rather know that than kind of guess and worry and wait and all that kind of stuff. So anyway, so thank you again, Dr. Crabtree, for being here. You've given us lots of really great, wonderful information. If people want to kind of get more information about who you are and what you're doing, where can they go to learn more about your clinic?
Yeah, absolutely. So you can check us out on Facebook, Pendleton Veterinary Clinic. We also have Lapel Animal Clinic in Indiana. There is a Pendleton Veterinary Clinic in Oregon. So seem like great people, but we just don't know that much about them.
I know you get calls for them.
Yeah, good stuff. Quite the commute if you schedule at the wrong clinic, though.
Yeah.
And then we have a website as well, pendletonvet.com. So check us out. If you have any questions, let us know.
And you're also on Facebook and some social media. So I think it's at Pendleton Veterinary Clinic on Facebook as well. If you're out there, always fun to see all the great things you guys are doing, and gals and everybody, the staff, the physicians, the techs, everybody there is they're an extended part of our family. We just love you guys to bits, and super happy to have you come back today. So thank you for that.
We appreciate it.
That's great. So before we say goodbye, we have some giveaway winners to announce. I'm super excited. So we had lots of great people who promoted today's event, and we were picking 3 winners to win. They each get a little notepad. And because these might not actually be the breed of your pup that you win, you're also getting a little magnet that says, my kids have paws. So the winners are Janet Hill, Vicki Davis, and Phoebe Simpson. So yay, Janet, Vicki, and Phoebe. Congratulations.
Awesome. Congrats.
I will get in touch with you, get your address, and get these out in the mail to you right away. So thank you again for helping to share all the love, the puppy love out there with what we're doing. It really means an awful lot. All of you mean a lot. Thank you again, Christy, and everybody else who's asked questions today. That made this event a lot more fun, a lot more interesting. And I love that we get to all learn from one another. So this has really been great. Thanks again. Thank you, Dr. Crabtree. We'll get you back here. We'll try to convince you to come back again. We love having you here. This has been a lot of fun.
Perfect. We'll be here.
All right. Thanks.
Thanks.
Bye, everybody. Have a great day.
Bye-bye.